Hi there, I'm Dr. Camilla Cameron. I've been a doctor of traditional Chinese medicine for the last 23 years. I'm also a vagus nerve stimulation expert and a women's health expert. Today's video, I'd really like to talk about what is perimenopause. So, this sign has been outside my clinic for a couple of months now, talking about how we can help you feel better when perimenopause is your problem. And the amount of people I've had ask me, what is perimenopause, has really surprised me. So, obviously, a lot of men have asked me, but also a high percentage of women have asked me, what is perimenopause? And that has prompted me to discuss with you what perimenopause is and its actual definition. The definition of perimenopause, I think, is probably not very helpful, and it is around menopause. So, what does menopause mean? So, menopause is literally 12 months from your last period. If you have not had a period for 12 full months, you are classified to be in menopause. So, I've had women who have gone 12 months without a period and assumed they were in menopause only to get a period 14 months later. So, I guess that's a pretty loose term, but the majority of women, if they miss a period for 12 months, are in menopause. And perimenopause are the years preceding menopause. So let's narrow that definition down a little bit so that we can get a much better understanding of what perimenopause actually means. So it's a great time of hormonal fluctuation. So this can last for 12 years for some women. And that basically means there are many hormones that fluctuate during this period of time. But this transition from, I guess, fertile to menopausal essentially means huge changes in estrogen and progesterone, as well as some other sex hormones. But these are the ones that really affect us and cause lots of imbalances within our health as well. The other thing to note about this 12 years that you could potentially be in perimenopause for is that a lot of women are experiencing perimenopausal symptoms before they actually ever expected to experience them. So, unless you have gone through primary ovarian failure, which is when the ovaries cease working before you are 40, and therefore you're going into an early menopausal state, or you've had a surgical hysterectomy, which has also removed your ovaries, and therefore you've gone straight into menopause after this. If you haven't experienced those two things, a normal time to experience perimenopause can begin at 35 years of age. And for some women who'll go through menopause a lot later, for example, maybe you won't start to experience symptoms of menopause until your early 40s. But it's not your 50s like a lot of people think it is. It's much earlier than most people expect. As I mentioned in the beginning, perimenopause involves pretty chaotic hormonal balance. And what controls this hormonal balance is how much your ovaries are actually functioning and whether you're ovulating. This is actually the number one determining factor of how balanced your hormones will be throughout your cycle, and that is whether or not you ovulate. To put in simple terms, what's occurring during your perimenopausal transition is your ovaries are slowing down their function. What they are doing is producing less eggs and therefore ovulating less. So, what this means in real terms is you will have more and more cycles throughout the year as you go closer to menopause that don't involve ovulation. And what does that mean for your body? When you ovulate, you produce a follicle, and then that follicle bursts, and that's ovulation. The bursting of that follicle is the egg being released. What remains of that follicle on the ovary itself is called the corpus luteum. And this corpus luteum it is what produces all of our progesterone after we ovulate. It's pretty clever, isn't it? So if you don't ovulate, you don't produce anywhere near as much progesterone, which means you are then in an estrogen dominant state. And when we talk about estrogen dominance, a lot of people think, oh, my estrogen's super high, which actually is sometimes the case. But quite often, more often than not, your estrogen is actually at a normal level, but your progesterone is super low. It's actually the ratio that is called estrogen dominance. So when you don't ovulate, particularly in the beginning of perimenopause, you will be in an estrogen dominant state. Especially in the early years of perimenopause, the focus should be on trying to increase levels of ovulation. So when people come to me in my clinic to be treated for perimenopausal symptoms, one of the things I'm really trying to address is getting their body to ovulate as much as possible. And this is generally through acupuncture and vagus nerve stimulation, and also using some supplementation to help the body along in that process as well. Because essentially, the more you can ovulate, the less your body will be in an estrogen dominant state. And as you'll learn in other videos of mine, estrogen dominant state is not a state we want to be in for our health. The closer you get to menopause on your perimenopausal transition, the more you'll notice that your estrogen is actually starting to drop. And this is because your ovaries are slowing down even more. And what happens is they produce the majority of your estrogen and progesterone. So as the ovaries reduce their function, these two hormones start to drop dramatically. We will also notice that there are more and more cycles that lack ovulation. And you'll also notice that cycles become much wider. So we can have cycles that are, 4 months long. You might only have 3 periods a year. And these tend to be much lighter than your normal periods as well. When you're dropping down to 3 or 4 periods a year, you can assume that menopause is around the corner. Most Australian women will complete their perimenopausal transition and go into a menopausal state between the ages of 45 and 60 years. On average, this occurs at the age of 51 in Australia. When this happens and you go from the perimenopausal transition into menopause, you'll find that your hormones are actually much more stable. And this is because the ovaries have completely stopped functioning, which means our levels of estrogen and progesterone are now extremely low and will remain this way for the rest of our lives. Thank you for listening to my video about perimenopause. I hope you got a better understanding of what that word means. We're hearing a lot more about perimenopause, but I think we're not actually understanding a lot of the time what perimenopause exactly means. I do have another video coming out which will be talking about the signs and symptoms of perimenopause, and there's lots and lots of them. So that's a really great one to listen to if you feel like maybe you're in perimenopause, but you're not too sure. So while I'm talking, I'd really like you to just have a bit of a look at the disclaimer behind me. And what this is all about is really talking about the fact that I am a doctor of traditional Chinese medicine, but I'm not necessarily your doctor of traditional Chinese medicine. And my videos that I put on YouTube are purely educational. They are not a diagnostic tool. However, should you like to book a consult with me, there is a booking link underneath this video as well, and we can discuss further any help I can give you with perimenopause.